Yeah. Hi, students. I am Dr. Badrinath. We are studying the subject pharmacology at present. In this video, we will see the estrogens. Okay. Keep in your mind, estrogens are the female sex hormones. Female sex hormones. Most of the students are confusing estrogens and progesterone. What is the main role? Most of the Some of the progesterone works will be done by the estrogen. Some of the estrogen work will be done by the progesterone. But there is some major difference is there. That major difference I have shown in the slide. Estrogens, female sex hormones. Progesterone's not calling as a female sex hormones. First of all, in the examination, if suppose they will give female sex hormones, means you have to write a estrogens, not progesterone. Mainly, the main job of this estrogens is the development of a female sex organs, right? Okay. And progesterone, main job is it favors the pregnancy, main job. However, keep in your mind, pregnancy, estrogen also helps for the pregnancy. Keep in your mind, that is also very important. Okay. And how to remember this means simple trick is there. How to estrogens, gen is there, gen. That's why generation, generating organs, female sex organs, like that you can remember. Gen, estrogen. In progesterone, there is no word of gen. Okay. Progesterone, pregnancy, PP, matching. Progesterone, pregnancy, like that you can remember, right? That is a simple technique. Clear cutly it differentiate the two terms. Okay. So automatically the job you can already know, since it is a female sex hormones, it is a female sex organs will be developed automatically. So in this video we will see only the estrogen concepts. Okay. And progesterone, I am making a separate video for the progesterone. Estrogens also, there is a 4 concepts are there. Keep in your mind. Estrogens, anti-estrogens, anti-name itself indicates which works against the estrogen. That is called a anti-estrogens. This slide is very, very important for all competitive and regular examinations. Okay, anti-estrogens. Okay, estrogen, anti-estrogen. Okay. Now you come to the aromatase inhibitors. This aromatase inhibitors, it prevents the formation of the estrogen itself. It inhibits the conversion of testosterone into estrogen. Okay, it prevents the estrogen hormone from the testosterone. Okay, testosterone is a male sex hormone. Okay, it converts into estrogen through the aromatization process. Number of times it was appeared in the question paper. What is the meaning of aromatization? Aromatization is the process of conversion of testosterone into estrogen. That process will be inhibited by the aromatase inhibitors. These are the list: steroidal, non-steroidal, that you have to be, all these things you have to note down and you have to practice well. So this prevents the estrogen synthesis. That's why estrogen actions will not started. Okay, will estrogen completely stopped by the aromatase inhibitor. Estrogen will not be initiated. Next, serums. These serums, not sperm. Sperm is different. Spermatozoa is different. It is comes in the male thing. Here it is a serum. SCRM. Selective estrogen. See the cursor. Selective estrogen receptor modulators. They have some speciality. What is that speciality? They have a dual action. It works as a estrogen agonist. It works also as a estrogen antagonist. See, first point keep in your mind, estrogens will do good for body and also bad for the body. Okay, but whereas the serums, it only to do the benefit of the body. It works for the benefit of the body. Whenever estrogen will do good, this serums acts as a agonist. Whenever estrogens will do bad to our body, there it goes and it works as an antagonist for the estrogen. Overall, if you take, the main goal of the serums is to do a good thing for the body. That I will take in a separate chapter. In this video, we will see only the first part, estrogen, not the anti-estrogen, aromatase inhibitor, serums. I am making a separate video. That video you can watch in the playlist. This is the unit 5 syllabus as per your university, and the point what I have highlighted with the reading, that is estrogen, that is the main topic today. That's it. The definition: estrogens are the substances which can induce as the estrus. That's why name is called as a estrogen, estrus. What is the estrus? Estrus is nothing but, here I have given the definition also, a recurring period of the sexual receptivity and fertility. These two are called as a estrus. Okay. In many females, estrus will be there. That estrus will be by the estrogen only. In a spayed female, spayed means both ovaries are removed. Ovaries are only, not uterus. So menstruation will be common. Only ovaries are removed. That is called a ovarectomy or spayed. This is as per the your K.D. Tripathi pharmacology book. Yeah, one basic point you have to keep in your mind, most of the students, women consist of mainly the estrogen. It is a female sex hormones, estrogen. And also they consist of a small amount of the testosterone. Most of the students, they are thinking that testosterone is a zero in female. No, some small quantity will be there. Okay. In the same fashion, gents consist of more amount of testosterone. It is a gents hormone only, testosterone. But they have a little quantity of the estrogen also. That point you have to keep in your mind. So here also both hormones will be there. Here also both hormones will be there in both female and male. Okay. Here, when the menstruation cycle stops completely, monthly periods completely, it become a zero. That phase is called a menophase. It comes in the around 45 to 50, 55 age. Around a 50, you can say 45 to 50 age, menstruation cycles will be stopped. It doesn't come never. So that phase is called a menophase. Okay, they are losing their reproductivity. In men's also, when the spermatozoa stops the development or generation of spermatozoa, then we can say that phase is called androphase. They will become infertility. Reproductively, they are not active. That is called androphase. That is a 55 to 60 age it comes. Okay, some more than that. There is a 4 types of estrogens are there in our body. That is in the female body. That is in the human body. Estrone, estradiol, Estriol, Estetrol. See, name itself indicates estrone 1. See here, see the cursor. Estrone 1 is there. E1. Estradiol 2 is there. Di means 2. Estriol, tree is there. Estetrol, E4 is there. Tetra means 4, we know very well. See, E1 is a more biologically active, but more potent is the E2. E2 is more potent. That point I will tell you in the next slide. The most biologically active is number 1. More potent, powerful hormone is the E2. The predominant, see, E2 is predominant type during the reproductive years from the age of 18 to the up to 45 or 50. That is during their reproductive years. E2 is a dominate. E2. Okay. And it plays a role in the bone and joint health. Joints are very important for humans. Bones especially, they are losing the calcium like anything. They are losing. That's why they need calcium in the high quantity. Estriol, E3, it is a predominant form of estrogen during the pregnancy. Okay, three means trimester, like that you can remember. Tree. Three trimesters will be 9 months. And E4 also, this type is a high during the pregnancy, E4 also. So 3 and 4 in the pregnancy. 2 reproductive years, E1 is biologically active. All are natural. See here, not it is prepared in the body by the body. E1, E2, E3, 4 are all natural estrogen. E1, E2, E3 are active and circulated in the blood. E4 appeared only in the pregnancy. All are inactive orally. If you prepared these hormones in the synthetically in the lab and if you are taking, it becomes inactive. It must be produced by our body own. Then only you can say it is a natural. Okay, and they have a very short duration of action. Short duration, not long time. It won't act. Short, rapidly metabolized in the liver. Okay, that's why opposite to that we are preparing synthesizing in the lab. That is called a synthetic estrogens. Okay, we are preparing in the lab, which is having a long duration of action, which doesn't metabolize it rapidly, which is orally active. That type of hormones we are preparing, estrogen hormones. That is called a synthetic estrogens. Okay, this is the natural estrogens. Yeah, these are the structures. Estradiol, more potent, very important point, most potent. V stands for victory, like that you can remember. 2, 2, V. Okay, predominant estrogen during the reproductive years especially. Okay, and estriol, weakest of 3 androgens. That is also very important point, and it has appeared number of times in the weakest estrogen is the 3, very weak. Okay. 3 also it looks like a reverse of a E. So W, if you reverse, you will get a 3. Weakest, like that simple technique. Okay, 3. If you make like this, it become a W. If you make like this, 3, it is a, okay, 3, like that you can remember. Predominant estrogen in the pregnancy, that is a 3 trimesters I told, 3 into 3. So that's why it is a predominant in the pregnancy. And estrone, that is a 1. It is a predominant in the menophase. Menophase, when the periods will stop, then that phase is called a menophase. How to remember this? Estrone, ONE1 is there. If you reverse this, menophase will come. Menophase. See here, ONE1. Name itself indicate. It gives the biggest clue name here. ONE1. Reverse it. Menophase. E2. More potent estrogen among the, it is a major among all the estrogen, major. Okay, because reproductive organs will be developed with this only. It is more potent than E1 and E3. Starting material for anything, any estrogen, starting material is a cholesterol, rapidly oxidized into E1 in the liver. That is also very important. In the liver only it is converted into which estrogen? E1. Okay. This is the biosynthesis of the estradiol, that is a 2E2. See, starting material is always cholesterol for all the steroids. Cholesterol must be converted into pregnenolone. Directly cholesterol doesn't gives the estradiol. Cholesterol has to convert into pregnenolone, pregnant alone, like that you can remember. Pregnant alone, pregnenolone name. Pregnenolone, after that, it is converted into some oxidation. See here, hydroxide addition, all these steps, and finally here you will get a estradiol, that is a E2. Next, regulation of the secret in the female. See here, estradiol, menstruating women daily, how much they will secrete the estradiol? 10 to 100 micrograms per day. Very round figures, all the numbers, easy to remember. That is also micrograms only, not much. Micro, not milli also, even milli also not there. Micro level only, but very powerful. It depends upon the phase of the cycle, either 10, 20, 30 or up to 100 it is released. That depends upon the phase of the cycle. Secretion always start with the Graafian follicle. I will enlarge all these diagrams in the next slide. I will explain you. Here you can find the Graafian follicle. Secretion is influenced by FSH. That is very, very important point. FSH. Okay. It influences the secretion of estrogen. Progesterone luteinizing hormone. Luteinizing hormone stimulates the progesterone synthesis, secretion. That is another part. Okay, here Fe, estrogen, FSH, F, F, E, F, both are same numbers, adjacent alphabets. So that you can easily remember FSH, estrogen. Okay, after E, you will get a F. Next, excess estrogen prevents the FSH, that is a negative feedback mechanism in the body. That is, we know very well. After ovulation, corpus luteum continues the secretion of estrogen. After ovulation, that is also very important bit. After ovulation, which part of the body secretes the estrogen? Corpus luteum. Before that, first Graafian follicle. During the pregnancy, placenta. That is also important. Placenta secretes the estrogen hormones. Placenta is an organ which is developed during the pregnancy. It is a special organ, just like a hand, eye, all the organs. It is also special organ which is only developed during the pregnancy. Here you can see these are the ovaries. We know this is the uterus, okay, fallopian tubes, and these are the ovary, normal ovary. This is some problem is there, polycystic ovaries are there. Okay, these ovaries, okay, if you see the ovary, the one ovary, if you cut like this, you will get all these parts here. You can see Graafian follicle here. This is this part you have to see that Graafian follicle. This part will starts the secretion of the estrogen. Okay, this is a placenta. The three diagrams you can take a snapshot. It is a special organ which is developed during the pregnancy. Later it disappears after delivery. Next, E2 in male. Males, I told no, in male. Male also some consists of a small amount of a testosterone. See here, this is the how it converted. Ring A undergoes the aromatization. Direct clue. A, B, C, D, 4 rings are there. We know very well steroids. A, aromatization. A, both matched again here. Ring A, aromatization. Testosterone converted into estradiol. This estradiol also again converted, interchanged into estrone or estriol. Testis is the main part which is developed in body. It takes place in the testis. Secretion is 2 to 20 microgram per day. That is a 100 microgram. Here only 2 to 20 microgram per day. And this is a testosterone. This is the estradiol. How this aromatase will conversion? This is the structurally. This is just in the namesake. For the names I have given. Whichever you feel that you can write in the examination. Synthetic estrogen, I told no, synthetic estrogens are prepared in the lab. Okay, it is prepared in the lab, orally active, all. Okay, whereas a natural inactive orally, slow metabolism in the liver, whereas that is fast, long duration of action, whereas a natural estrogen slow. So that's why we are preparing in the lab. What are the characters we need actually? It is a two types, steroidal, non-steroidal, which consists of a steroidal ring, which doesn't consist of a steroidal ring. Steroidal, ethinyl, estradiol. Estradiol we know, ethinyl, that you have to keep in your mind, ethinyl. Menstrual, menstruation, like that you can remember. Okay, menstruation. Tip alone, TIP, tip alone, like that you can remember. Tip alone. Next, non-steroidal, diethyl stilbestrol, still best. Still, even though it doesn't consist of a steroidal ring, still it is best. Stilbestrol, like that. Diethyl stilbestrol, also called as a stilbestrol. Hexastrol, 6. Hexa means 6. Diensterol, diene, to in. And actions of the estrogen, mainly sex organs. It develops the sex organs. I told no, it is a female sex organ responsible for the pubertal changes. Puberty means become a girl will become a woman. That is called a puberty. It become at the age 18 will start. Puberty means adult. Puberty means adult. Okay, responsible for pubertal changes, growth of uterus, See this growth of uterus, fallopian tubes, vagina, menstruation in an ovulatory cycle enhances the sperm penetration. See here, sperm is penetrating into the ovary, that is egg. Okay, deficiency leads to atropic changes in female reproductive rate. Secondary sex care. These are very very important. All this slide is very very important. In the breast, see in the breast what happened? Proliferation of the ducts and stroma, accumulation of the fat. See, high estrogen, they will become a tummy. Estrogen levels is more, they will become a tummy. Fat will be go on accumulating. High estrogen level you have to keep in your mind. This is the balanced estrogen. She is maintaining figure. She is not maintaining the figure because of not her problem. That is a hormonal problem. That is a estrogen. Pubic and axillary hair appears, and feminine body contours and behaviors will be changed. Estrogen is having a two receptors. Only you can keep in your mind ER alpha, ER beta. ER alpha is all estrogen receptor. ER means estrogen receptor. ESR1 also, it is also called as a ESR1. That is a estrogen receptor 1 alpha, estrogen receptor 2 beta. We know beta means 2, alpha A1, A1 matched, beta is a second alphabet, beta 2, like that easily you can remember. And it is present where it is present. That is important. Alpha receptor, uterus, vagina, ovaries, mammary gland, hypothalamus, endothelial cell. Okay. And these are the lungs, brain, prostate gland in the male, prostate. Okay. Ovaries, lung, brain, all will start with the BB here. So since it is a beta, see here, brain, bone, P. It is also almost like a P, B. Okay. Prostate. Okay. Like that you can remember. This is the mechanism of action. It's very simple. Estrogen will enter estradiol. This is E2 will enter and it forms a ER. ER I have mentioned here, estrogen receptor complex. Conformational changes and dimerization will take place and it forms a ERE, estrogen response element. This is very important. This gives the response. So that according to that proteins will be synthesized. Okay. This is the mechanism of action in the running matter. Estrogen receptor analog, like just like other steroidal receptor, it agonist binding the ligand binding domains. Without the receptor, estrogen response element will be formed. Okay, gene transcriptions will be takes place. Okay, this is all these are the running matter. If you want to write in the exam, you can be take a screenshots and you write the same diagram only I explained in the figure. AF1, AF2, this is also important. AF1, AF2 are the domains for the androgen. Okay, just like a domain. So this estrogen will come and sit there. Okay. Estrogen therapeutic uses, mainly using for the post-menopausal hormonal therapy. Hormonal after menstruation, when the stops, then they will start estrogen you have to give. Otherwise, there is some various serious problems will be there that we will see. As a contraceptive, estrogen not only it helps the pregnancy, like a sperm penetration into the egg, it also stops the estrogen. If it is a high level, it stops the pregnancy as a contraceptive. That's why estrogen you have, it's a very great care you have to be take. Dysfunctional uterine bleeding, acne, not agni, not agni. This is acne, ACNE, just like a pimples with a pain. Carcinoma of the prostate gland in the male. If it is there excess, cancer will be takes place in the dysmenorrhea, pain during the menstruation, dysmenorrhea. Delayed puberty in girls, they will not become a woman. Slowly they will become a woman because estrogen deficiency. In such a case, you have to give the estrogen. Okay. Uh, and senile vaginitis, that is a dryness of the vagina, especially after the menopause. These are the hormone replacement therapy when they are giving. There is a 5 common symptoms are associated with the hormone replacement therapy, H or T. See, after menopause, all these problems will come. Then you have to give the estrogen. Keep in your mind. Osteoporosis, it starts where bones will become very weak from the menopause, from the age of 45, especially in the women. In such a case, you have to. Vasomotor symptoms. Okay, that is also will started. Hot flushes, your face will become a hot heat from the menopause. Okay, in such a cases you have to give. That is called a hot flushes. Vasomotor symptoms from the brain. Some symptoms will come. Vasomotor symptoms. Serious problems will come in the female. So you have to treat with the estrogen. You have to do a hormone replacement like a improved the HDL. It improves the HDL, which is a good for body. LDL ratio, but it increases the risk of thrombolism, increases the risk of myocardial infarction. Okay, like that, some problems will come. And urogenital atrophy, arrest the genital atropic changes, some problems will come. These are the HRT, that is a hormone replacement therapy, generally includes the administration of estrogen as well as the progestin combination. Hormone replacement therapy starts from menopause. Both you are giving estrogen as well as a progesterone combination, that depends, the doctor will decide. Okay, it is a given for shortest possible duration. Okay, and small effective doses. Okay, and these are some regimens are there. Timely, how much dose. Okay, cyclically 3 weeks treatment, like that. That is very complex processes. And it is estrogen is prescribing, especially in the primary ovarian failure. Ovaries will be failure. In such a case, you have to give a estrogen. Okay, and dysfunctional uterine bleeding. Okay, we know that sex organs will be developed with the estrogen. When there is a no proper sexual organ development, then you have to give a estrogen. Acne, not agni. Okay, dysmenorrhea, pain during the menstruation, using as a contraceptive also. If you are taking extra estrogen, extra progesterone, it works like a contraceptive. It avoids the pregnancy, it terminates the pregnancy. Senile vegetalis, like a dryness of vagina, carcinoma of the prostate. Gents, we have to give estrogen. Tablets you have to supply so that it stops the prostate cancer. Estrogen side effects in the male, what happens? See here, libido, suppression of the libido. Sexual capacity is called as a libido. Okay, gynecomastia, development of a breast in the male is called a gynecomastia. Okay, feminization, children's, this is the problem. Postmenopausal, after menopause, this risk of irregular bleeding and endocardial carcinoma, cancer will be developed. Okay, breast cancer, growth of existing breast, that is a main problem of the estrogen. It increases the risk of breast cancer. Okay, like that, all these are the pregnant women. Okay, like this, these are the side effects. High estrogen in men leads to stroke. See here, stroke, heart diseases, prostate cancer, breast size, enlarged, see here, enlarged prostate and prostate cancer. This is the main estrogen level in the men. Loss of muscle tone, it becomes like a only bone, there is no muscle, only fat and bone will be there. Okay, and this is the balanced estrogen. This lady maintaining the figure, this lady not maintaining the figure because of the high estrogen problem. Okay, so this is my next topic, next video, anti-estrogens, serums, aromatase inhibitors. Okay, I will complete my video here. Thank you. In my playlist I have kept all the videos, you just watch it.